Hello my dear curious and studious students of surgery, myself Dr. Mahesh Chaudhary. I am warm welcoming you in my surgery lecture series. This surgery lecture series contains entire surgery with anesthesia, with radiology, with orthopedic. So stay tuned with us. Let's start our surgery lecture series. Welcome dear students in my surgery lecture number 79. That is the cysts. In this lecture, we will cover only the cysts all over the body, the types of the cyst, that is the retention cyst, dermoid cyst, teratomatous dermoid cyst, sebaceous cyst and their treatments. Now start with me the cyst. A soft, fluctuant, swelling containing fluid in the sac lined by the epithelium and endothelium is called a cyst. The word cyst is derived from a Greek word meaning bladder. Classifications. Two types of the classification of cyst are known in surgical practice. That is the first type, true cyst and false cyst, that is the pseudocyst. True cysts are lined by epithelium or endothelium. Though if infected, it may be lined by granulation tissue. The fluid of true cyst may be either of the following two varieties. First, it is usually serous or mucoid and varies in color from the almost colorless and brown staining due to the presence of altered blood, and collateral crystals are often present in the fluid. And second, the content may be porridge or toothpaste-like due to the accumulation of the desquamated epithelium within the secretion. Such content is usually found in dermoid, epidermoid, brachial cyst and sebaceous cyst. And second type of the cyst is, that is the first type, false cyst or pseudocyst. These may be of the following types: exudation cyst, degeneration cyst. First, exudation cyst. Such cysts develop from exudation of fluid and rare limited in anatomical spaces, that is the pseudopancreatic cyst, insisted collection of fluid in the laser sac. Fluid of the tuberculous peritonitis lined by adherent coils of intestine, vaginal hydrocele, bursa. Degeneration cyst, second type of the cyst in the false cyst, that is the degeneration cyst. Such cysts develop as a degeneration in the center of malignant tumor due to the hemorrhage or ischemic necrosis or colligative necrosis. Apoplectic cyst is an example of this type. Now the second type of classification is a congenital and acquired. Congenital cysts are following varieties, that is the secretion dermoid, tubuloembryonic and tubulodermoid cyst, cyst of the embryonic remnants. These are the congenital cysts. First is the secretion cyst, dermoid. This type of the cyst develop at the line of the closure of the embryonic clefts due to the burial of dermal cells in this fusion line. The usual sites are in the midline of the body, partially in the neck. At the outer angle of the orbit, angular dermoid is the upper part of the anterior triangle of the neck, which is known as the brachial cyst, developed due to the persistence of the precervical pouch after fusion of the brachial clefts. Second congenital cyst is the tubuloembryonic or tubulodermoid cyst. Such cysts develop in the tract of the ectoderm tube, that is the thyroglossal cyst from the thyroglossal duct. Now the third congenital cyst is the cyst of the embryonic remnants. Certain cysts develop from embryonic tubules or ducts which normally disappear. The example of such cysts are of the urachus and vitellointestinal duct, hydatid or morgagni from the remnants of the paranephric ducts. Cysts from the remains of mesonephric duct, that is the Olfean body, which is known as the organ of the girals. Second type of the cyst is the acquired cyst. The various types of the acquired cyst are as follows: retention cyst, distension cyst, exudation cyst, degeneration cyst, cystic tumors, implantation dermoid, traumatic cyst, parasitic cyst. All these are the acquired cyst. Now the first, retention cyst. Such cyst develops due to the retention of the secretion of a gland due to the obstruction of its duct. The common examples are sebaceous cyst, cyst of the breast, mucous cyst of the lips and cheeks, pancreatic cyst, parotid cyst and Bartholin cyst, etc. Dear students, here is the typical picture of the retention cyst. Next is the distension cyst. Such cyst develops from distension of the normal acini or follicles of a gland, that is the thyroid cyst, ovarian cyst. Lymphatic cyst and cystic hygromas are also included in these varieties. Such cyst also develops due to the distension of lymph node sacs or lymphatics. Exudation cyst. This type of the cyst develops due to the exudation of fluid into an anatomical space already lined by endothelium, that is the vaginal hydrocele, bursa and pseudopancreatic cyst. It is noteworthy that these are usually false cysts according to the previous classifications. And next cyst is the acquired cyst, degeneration cyst. These are degeneration cysts mentioned under the group of false cysts. Cystic tumors. Next cyst, that is the derived cyst of the ovary, cystoadenoma of the ovary, cystoadenoma of the breast, etc. Next cyst is the implantation dermoids. Such cyst develops when squamous epithelium of the skin is driven in the penetrating wound. Such cysts are easily seen in the finger, hand or sole of the foot. Next cyst is the traumatic cyst. Sometimes hematoma within the muscles, fascia and subcutaneous tissue may resolve into a cyst. Such cyst contains straw or brown color fluid containing cholesterol crystals and is usually lined by endothelium. Next, acquired cyst is the parasitic cyst. In this group, the commonest is the hydrated cyst of various organs like lungs, livers, developed from the infestation of Tinea echinococcus. Such cysts are mostly seen in the liver or lung, though they may be seen in other parts of the body as well. Besides hydrated cysts, other cysts in this group are cysticercosis due to the infestation of the Tinea solium. The cysticercosis is the intermediate stage of the parasites. This is mainly a disease of the pig, though human beings are rarely affected. We see details of this parasitic cyst in the liver hereditary cyst. Now the clinical features of the all cysts are: first, history is to be taken. A few points are particularly noted in the history, that is the duration of the swelling, whether the swelling is present there from birth or it is recent origin. Next point in the history is how did the swelling appear, whether the spontaneous or falling injury or disease. Next point in the history is the pain, whether the cyst is painless or painful. Painful cyst is mainly inflammatory or indicates presence of secondary infection. And next point in the history, that is the growth of the cyst, how fast is the growth is of swelling is. And the next point in the history is the general health, if the swelling is associated with anemia, anorexia and cachexia, possibility of the cystic tumor or degeneration cyst should be considered. Now the physical examination of the cyst is important. First is the inspection. Site is highly important as dermoid cyst is often diagnosed by the site alone. Certain congenital cysts are also diagnosed easily by the site alone. And next point in the physical examination inspection is the number is also important as the multiple cysts are characteristically seen in the sebaceous cyst. And the third point is the surface and margin. The smooth surface and regular margins are characteristic features of the cyst. Now the next point of the physical examination in the cyst is the palpation, surface and margin. Palpation reveals smooth spherical surface with regular margins. And the next is the consistency. A cyst is usually soft in consistency. When the fluid inside the cyst remains under tension, the consistency may be even hard, but the center of the swelling will yield on pressure. This is not possible in case of the solid tumor. Next palpation is the fluctuation. A cyst is a fluctuating swelling. Fluid thrill. In case of the big cyst, fluid thrill test will be positive. Next point in the palpation is the translucency. While a few cysts are brilliantly translucent as their surfaces contain the clear fluid. Now the effect of the cyst. A cyst may press on neighboring structures, particularly the blood vessels, to cause the venous congestion and viscosity of the veins. That is the ovarian cyst causing varicose veins of the lower limb. Cyst may press on neighboring ducts, that is the choledochal cyst pressing on the common bile duct. Now the complications of the cyst are infection, hemorrhage, torsion and complications. Now particularly we see some major cysts like dermoid cyst. A dermoid cyst is a cyst which lies deep to the skin and is lined by skin. So a dermoid cyst can be called an epidermal cyst. These cysts are lined by the squamous epithelium and contain pultaceous or toothpaste-like material which contains desquamated epithelial cells. These are 4 types of the dermoid cyst: sequestration dermoid, implantation dermoid, acquired variety, tubular dermoid and teratomatous dermoid. Dear student, you can see the picture of implantation dermoid in the finger in the diagram. First is the sequestration dermoid. This is a congenital variety of dermoid cyst which is formed by the inclusion of the epithelium buried at the embryonic fusion. So these are found along the lines of the fusion of the 2 embryonic segments. Dear students, here the clear-cut picture of the dermoid cyst. Second is the dermoid cyst in the ovary. Now the next point is the teratomatous dermoid. This is a cystic swelling developed from the totipotent cells with ectoderm predominance. Such cyst usually contains mesodermal elements like bone, cartilages, etc. Hairs are almost always present in the such cyst. So the usual content are bone, cartilages, tooth, hair and cheesy material. Common sites are ovary, that is the ovarian cyst, testis, teratoma, mediastinum, mediastinal cyst, retroperitoneal cyst, post-anal that is the anal dermoid. Dear students, here is some teratomatous dermoid cyst in the picture you can see. Now the next is the sebaceous cyst. Sebaceous glands are present in the skin. These glands secrete sebum, which keeps in the skin soft and oily. The duct of the sebaceous glands mainly opens into the hair follicles and rarely may open directly onto the skin. If the duct or mouth of the sebaceous gland becomes blocked, the gland becomes distended with its own secretions and forms a sebaceous cyst. So this is a retention cyst and is most accurately called epidermoid cyst, since such cyst is lined superficial squamous cells. Now the pathology. Such cyst is lined by the squamous epithelium and consists sebum, which is yellowish, pultaceous material with unpleasant smell. Such material contains sebum, fat and desquamated epithelial cells. Now the common sites of the sebaceous cyst can be seen anywhere in the body, but mostly common seen in those parts where there are plenty of sebaceous glands, that is the scalp, face and the scrotum. Dear students, here is a clear picture of the sebaceous cyst. There is a punctum in seen in the central ear, that is the black in color. This is the multiple sebaceous cyst, epidermoid cyst on the scrotum, and this is the picture showing the two sebaceous cysts on the scalp. Note that the punctum cannot be seen, which is the common finding of the sebaceous cyst on the scalp. So always remember that in the sebaceous cyst of the scalp there is no punctum, but elsewhere in the body except scalp there is a punctum in the sebaceous cyst. Now the clinical features. It is a typical cystic swelling which is spherical in shape. The surface is smooth and there is a bluish and blackish spot or punctum which indicates the blocked opening of the duct. Due to the presence of the sebum, there may be indentation due to the pressure with fingertips. Now the treatment. Total excision of the cyst is the treatment of choice. Two kinds of the procedures may be adopted. First is the dissection method and second is the incision avulsion technique. First dissection method, an elliptical incision is made on the skin including the punctum. The cyst is gradually dissected from the surrounding skin till the entire cyst can be removed intact. It must be remembered that the whole of the cyst wall must be removed, otherwise the recurrence is inevitable, means recurrence is confirmed if the cyst of the wall is not removed completely or in toto. Second type is the incision avulsion technique. Incision is made through the skin into the cyst, content of the cyst are squeezed out, then the cyst is carefully avulsed out. Now the complications of the sebaceous cyst are infection, ulceration, sebaceous horn. Slow discharge of sebum from a white punctum sometimes harden this form the sebaceous horn. Next is the calcification. This is a rare complication, though it is seen in the sebaceous cyst of the scrotum. Malignancy. Very rarely malignancy may develop, which is often in the form of the basal cell carcinoma. Dear students, here is the end of our surgery lecture number 79, that is the cyst. Thank you.